How do you think California's reopening is going to go? Do you think the state is ready?
Well, look, the state's very diverse. I know Bob Kocher well. He's been working on this from the outset and working very well on it with the state. It's a diverse state. So there's a lot of different parts of the state, some that haven't been hard hit, some that have. As Bob mentioned, Southern California is still showing increases in cases. Los Angeles is still showing some increases in cases. Northern California is actually doing quite well, and San Francisco has been aggressive from the very outset, putting in place a stay-at-home order, the first city to do it on, I think, March 18th, a long time ago now. And parts of the eastern part of the state and the western part of the state have different epidemics. And so I think it's appropriate that they would give discretion to local officials, like the federal government's doing with the states as well.
Yeah, there's still been some frustration, though, in states about a lack of a national testing plan, that it is being left to local jurisdictions, whether it's cities or states or those in charge on the ground locally.
Well, look, I think where the federal government can be helpful is trying to provide the capacity to the states, trying to help them get access to that testing supply chain, which is really an international supply chain, both the reagents that are used in testing as well as some of the low commodity products like the swabs and the plastic pipettes that are used to run the samples. But ultimately, in terms of standing up testing sites, I think the states have more of a capacity to do that. And more ability to tailor that to local needs. The government can also be helping with resources. The federal government Congress did allocate resources to states. I think there probably should be more money put into trying to get testing scaled up going into the fall. And there's actually some bills before Congress right now that would do that, that would create more of a national surveillance system. I would expect legislation like that to move with the next stimulus package when one comes through Congress.
Let's move to another big story today. That is the White House apparently blocking the CDC from releasing its 17-page step-by-step reopening document. Reports say because they think it's too stringent. You're calling for its release, and you did on Twitter today. You say, quote, a lot of businesses literally can't open without it. CDC must publish its umbrella document. When you hear tonight, Dr. Gottlieb, that it is being blocked by the White House, what is your reaction?
Well, the White House statement tonight was that it's too prescriptive, and they sent it back to CDC for revisions. It's not really clear if the revisions are going to be around the substance of it and the content or more the tone of the document. But the reality is that in a public health emergency, the CDC becomes the de facto regulator for a lot of businesses. There's literally some businesses that can't reopen without permission from the CDC, but a lot of businesses don't want to reopen without permission from the CDC, especially travel-related things and transportation-related businesses. So it's important that CDC does put out sort of an umbrella document that addresses general guidance to industries, and then they're going to have to put out more specific documents that address specific aspects of certain industries like airlines, like restaurants, like hospitality businesses. And so this is something that CDC does. It's sort of the bread and butter of the CDC, especially in the setting of a public health emergency. So it's important that these documents do start to come out.
Do you worry, though, that a watered down, so to speak, document is going to put more people at risk?
Well, we'll see what it is. I mean, I think it's important that the CDC be able to give clear guidance and guidance that's detailed enough that it gives good direction to businesses on how to provide safety. I think the irony here is that if the concern is that this may be too prescriptive for businesses and actually impede flexibility, impede business from going forward, the opposite is true to a large degree, that in the absence of guidance, a lot of business can't go forward. And so I think it's very important that CDC speak in a timely fashion. Typically, it would be putting out these kinds of guidance documents in the setting of a public health emergency as we look to try to resolve some of these issues.
You comfortable, Dr. Gottlieb, with the way that some states are extending their stay-at-home guidelines? I heard from one very big investor today who wonders locally here in the New Jersey area whether it's too strict for too long and that we should start letting some businesses reopen sooner, thinking that people are going to be smart enough to deal with this in the right way. Restaurants, for example, even opening at 25% capacity is better than those staying closed for too long, even over Memorial Day weekend, which for some is a big weekend for business.
Yeah, well, look, I've had conversations with the New Jersey governor. I don't want to second-guess the decisions of the governors because they understand what the situation is like on the ground. I think that a lot of states are diverse and can give discretion to local officials to make different kinds of decisions like what California is doing. But in some respects, New Jersey might have been the hardest hit state. We think of New York as the hardest hit state, and New York City was very hard hit. But as a state, when you look at the data coming out of New Jersey in terms of how hard hit they were, the positivity rate, the number of positive cases they still have as a total of what's being tested, the burdens on their hospitals. New Jersey was extremely hard hit, and in some respects, we could argue was the hardest hit state. So it doesn't surprise me that coming out of this, they're going to be the most cautious.
We know that a number of states, Dr. Gottlieb, are opening, yet they don't meet some of the guidelines that the White House had put out initially. Do you think that in some respects the White House is going for a de facto herd immunity here by pushing people to reopen perhaps earlier than they may be ready to do and see what happens, essentially? I've seen some suggestions of that.
Yeah, I certainly don't think that. The reality is that we are a long way from herd immunity. Even if we continued at the current rates of infection, which hopefully we won't, hopefully we will see some slowing as we head into July and August. But even if we continued at 30,000 infections a day diagnosed, which is really probably 300,000 infections at least, because we're not diagnosing more than probably 10% of the infections. But even if we continued on this trajectory, by September 1st, about 15% of the U.S. population would have been infected with coronavirus, which is far, far short of herd immunity. So I highly doubt, I mean, the White House has good models and they know the math better than I do. I highly doubt that in the back of their head there's any kind of plan to get to a de facto herd immunity by reopening. I think what the White House is doing is what they've done from the outset, and you can criticize it or you can laud it, but what they've done is give discretion to local officials and governors to really make the decisions about what's happening within their states. And so the White House isn't pushing the states, really. They're not impeding the states. They're largely leaving it up to the states.